Okay, so first off, I want to let you all know that this video is for educational purposes, all right? I'm going to talk to you today about something called a vaginal dilator set. Contrary to what you might be thinking right now, you're probably asking yourself, why would you want to stretch your vagina? All right, rightfully so. I'm going to tell you right now that I feel like the US in general does a really not super stellar job of letting you know what happens to your body during certain things. Perhaps you're a person who experiences pain during vaginal penetration. Perhaps you experience pelvic floor spasms. Maybe you experience vaginismus. Or maybe your doctor has recommended that you look into the use of a vaginal dilator set. Let me explain how they work. Now let's start off by saying that the size that you start off with totally depends on where you need to be at when you first get started with using a vaginal dilator. If you have an extreme case, you may need to start with something that's very small, which is about the size of my pinky, all right, if you're really struggling with tightness in the vagina. So to get the most out of your vaginal dilator therapy, let me explain a few steps that you may take. Number one, find a quiet place. Sit down, relax, take a few deep breaths in, find yourself some inner peace. Second step is you're going to lay back, knees bent, possibly in a diamond shape, and just get comfortable without any type of tension. Okay, the third step is going to be to choose a dilator that you feel like is going to be the most comfortable for you without it feeling too small or without providing too much tension. Okay, and once you choose that, you're going to apply a water-based lubricant to that dilator. The next step you're going to take is to slowly insert the dilator where it's comfortable, and once it reaches a point where it feels like there's too much tension, please don't force it in. Just kind of let it set there and just wait a few. I want to reiterate, you want to get to the point where you're going to feel some tension, but we're not forcing anything in. Okay, the next thing you're going to do is you're going to do a few different types of Kegel exercises. That's when you squeeze and release. And what that's going to help you do is, again, relax those muscles. And then if you can get in a little deeper, go ahead and do that. Again, the idea is to work up to a larger size as needed when you're ready for it. You can also use a dilator to gently move it in or out, up and around, to kind of help you stretch that vaginal opening. You're going to want to go ahead and work through that about 10 to 15 minutes as your doctor recommends. And that's a vaginal dilator.